Hi, my name is Dr. Joe Childs. I'm a board-certified chiropractic neurologist, and on this video today I'm going to talk to you about fibromyalgia. I'm going to talk to you about our fibromyalgia, our drug-free fibromyalgia relief program that we do in our office. I want to let you know that I've been in practice here in Downingtown, Pennsylvania for 11 years, and I want to let you also know that we've been helping patients overcome fibromyalgia, chronic pain that they thought they were going to have to live with their whole life. And the great thing about it is we do it without drugs or surgery. So we're going to talk about that today. We're going to talk about our fibromyalgia program. Let me talk a little bit more, or let you know a little bit more about my qualifications, because I understand that patients with fibromyalgia have really been through the ringer. They have gone to lots of different doctors. We're going to talk about some stats on that today. A lot of them have been to chiropractors. A lot of them have been to sort of regular chiropractors, or chiropractors that only do adjustments and things like that to the spine, or work with musculoskeletal conditions. I'm a little bit different in that I've had training in neurology. Again, I'm a board-certified chiropractic neurologist. And just like in medicine, there are medical neurologists or medical orthopedists. In chiropractic, you can specialize also. So you can go another 2.5 years of school and become a specialist in chiropractic neurology. And that's what I've done. And it's been great. It's been a real blessing for our fibromyalgia patients, because fibromyalgia patients, again, they're very sensitive. They can't take some of the adjustments that a chiropractor does. And so what we do is we treat the brain and nervous system, but we do it without drugs or surgery. Like a medical neurologist treats with drugs and surgery, or what we do in our office is we treat with the things I'm going to talk to you about today, natural means. The other thing about me, again, I'm Dr. Chiropractic. I'm fellowship trained in functional neurology, which is drugless neurology. I'm fellowship trained in child neurodevelopmental disorders. I see a lot of kids with things like autism and ADD and ADHD. I'm trained in functional nutrition and blood chemistry. I'm also trained in spinal decompression and spinal biomechanics. So let's get started. This is the big question. What makes us different from every other doctor you've seen? Because as a patient with fibromyalgia, you've been to a lot of doctors. What makes us different is we treat patients metabolically and neurologically. We treat fibromyalgia that way. We're going to talk about exactly what that is, because you need to do both of those things. We're going to get to the root cause of your fibromyalgia. We want to find out why you actually have fibromyalgia. We're going to leave no stone unturned in finding out why you're dealing with fibromyalgia. Okay? 3 R's of fibromyalgia. Again, fibromyalgia is real. A lot of times people will say, you know, Doc, nobody really believes me the way I feel. They think it's all in my head, which fibromyalgia is in your brain, but it's not in your head the way you think I am saying that. It's basically that it's a neurological problem, but it's not in your head. It's a real thing. So you need support from your family. You need support from your spouse in getting better. Number 2 is fibromyalgia is reversible. A lot of people don't realize that fibromyalgia is reversible. They think it's sort of that stigma sentence. You know, once you get fibromyalgia, you're going to have it for a lifetime. Not true. We get patients to overcome it all the time. Number 3 is fibromyalgia is not reversible with drugs. What drugs do is just cover the symptoms. They do not correct the cause like we do. We're going to talk about that. Average fibromyalgia patient has tried 12 different medications. Okay, the average fibromyalgia patient has been to 10 different doctors, have gone 10 years prior to diagnosis. So I know you're looking for some answers. In fact, I've had patients come in with 20 different medications, and we've been able to get them not to need those medications. Now, I don't tell you to take off or go off of your medications on your own, or I don't give you that advice, but as you get healthier, as we get to the root cause of the problem, the metabolic and neurological cause, you can go back to your doctor, and your doctor will be pleasantly surprised how you'll be able to get off of some of these medications. Okay, again, Einstein once said the definition of insanity is doing the same thing over and over and over again and expecting a different result. And that's unfortunate, because a lot of fibromyalgia patients get to this point that they just keep taking more and more and more and more medication. By the time you know it, they're now taking oxycodone and morphine drugs, highly addictive drugs. In fact, Lyrica and Neurontin, which are commonly prescribed for fibromyalgia, Lyrica is not even a drug for fibromyalgia. Lyrica was first a drug for seizures. It shuts down the way the brain functions. So again, you don't want to necessarily be on all these drugs. You want to try to find something that gets you healthy from the inside. We're going to talk about that. So again, fibromyalgia is a neurological condition. It's not a muscle problem. That may be shocking to you, because you have that pain all over your muscles and your muscles feel stiff and achy and you got trigger points, but it's not a muscle problem. It's a neurological problem. And it has to do with your brain. We're going to talk about that. Your brain requires two things to function and survive. It requires fuel and it requires activation. Fuel is glucose and the food that we eat, and it's also oxygen, and it's activation, the stimulation that we give. So again, we treat patients metabolically, which is fuel, and neurologically, which is activation, to make their brain healthier. So the first thing I want to talk about today is I want to talk about the metabolic side, the left-hand side, so to speak. Now, with our metabolic care, we need to do specific blood panels. We need to do a complete metabolic panel. We need to look at your glucose. We need to look at your cholesterol. We need to look at a CBC. We need to see if you have any anemias. Do you have any white blood cell differential issues? Do you have high lymphocytes, high neutrophils? We need to look at your thyroid panel, a very specific thyroid panel, not just TSH. We need to look at antibodies. We need to look at your T3 uptake. We need to look at your T3 and T4, free T3 and T4. We need to do all those things. Now, everybody always says at this point, well, doc, I've already had all those tests. The doctors say I'm normal. So what are you going to do with these tests? Well, here's the deal. Those tests that you've had are not normal. Bring your blood work in to see us. When you come into our office, we'll look at it. Because that blood work, the ranges that your medical doctor looks at are what's considered the lab ranges. Lab ranges are inaccurate because they're bell curves. What they do is they look at all of the people giving blood in the entire country, sick, people with very bad conditions, and healthy people combined. So you're the average of everybody, even the sick people. We look at what's considered the functional lab values. The functional lab values are basically the average of all the healthy people. So you want to be the average of the healthy people. So when you bring your blood work in, we're going to be able to see that you're not in the functional range. It's very important that you're in the functional range. This is why your lab test may be normal, but you still feel bad. You go in, your doctor says, hey, lab tests are normal. I don't really know why you feel the way you feel. And that's why people think sometimes fibromyalgia is in your head because everything looks good. That's not true because you're not in the functional ranges. For example, glucose should be 85 to 100. That's functional. Traditional is 65 to 110. Okay? So you can be 79, which is considered reactive hypoglycemic, which could be causing all types of stress, all types of cortisol issues and things like that, really affecting you, but your medical doctor or your doctor is going to look at you and say they must be normal. Okay? The other thing we run is an adrenal stress index. What an adrenal stress index is, it looks at the adrenal glands, which sit right above your kidneys. And what these adrenal glands do is they secrete cortisol and they secrete your stress hormones, your epinephrine and norepinephrine. Patients with fibromyalgia have abnormal adrenal function. They either have high adrenal functions, too much cortisol, which really affects the way their brain functions, causes them to have trouble losing weight, fat around the waist, or they have adrenal burnout. Okay? And this can cause them to have insomnia and all types of things. So we have to test the adrenals. It's a salivary test. We do it 3 times a day. Okay? Again, if you suffer from insomnia, which patients with adrenal issues and fibromyalgia, I mean, the hallmark of fibromyalgia is insomnia. Well, guess what? If you have your adrenals are fatigued, what's going to happen is in the middle of the night, you're going to wake up in the middle of the night. You'll be up the rest of the night. If you have too much cortisol, you'll never get to sleep in time. Okay? And so what happens is we get a complete profile, what's basically considered your circadian rhythm. It's going to let us know exactly what's going on with your circadian rhythm, your cortisol rhythm. Fibromyalgia patients are almost always in bad shape. Chronic fatigue patients, almost always in bad shape when it comes to their adrenal stress index. The other thing we need to do is we need to do sensitivity testing. Sensitivity testing is looking at different foods that you're eating that may be causing an IgG reaction, which means it's a sensitive reaction. It's sensitizing. It's causing an immune reaction in your body. So we have to test you for the big 5, which is gluten, casein, eggs, soy, and yeast. We got to test this. We have to run the test. Now, this always comes up with patients who always say, well, I was already tested for celiac disease. Celiac disease is the worst genetic allergy that you can have. It will just ravage your intestines. Most patients with fibromyalgia, if they had celiac disease, they would know it by now. But what happens is patients have adrenal issues and they have food sensitivities and they don't know because they don't get the test. The celiac test is not sensitive to pick up food sensitivities. So we have to do a stool test. Stool test is what we do. Again, sensitivity testing, we have to test these things. You're going to have chronic pain, frequent indigestion, fullness after meals, bloating after meals, frequent loose bowels, bowel movements that are, again, frequent, constipation, vomit often, mouth ulcers, and the test is run, and when we run the test, it's in units of 10. Anything over 10 means you're sensitive. So I had this fibromyalgia patient that came in the other day. We ran her test. She was 110. We got her off of gluten, started working on her brain. She's unbelievable. She's doing unbelievably better. She's sleeping better, things like that. We needed to run an intestinal permeability test. We need to make sure that you don't have a leaky gut. We need to make sure that your bowels are working good. You've got barriers in your body. You've got the respiratory barrier, you have the skin barrier, you have the blood-brain barrier, and you have the gut barrier. The gut barrier separates the food coming through your gut and your blood. The only thing that should go through that gut, it's like a screen door. The screen door keeps the bugs out and lets the air in. That's the way your gut should be if it's not leaky, if the intestinal permeability is not too much. So what happens is when food comes down into your intestines, it needs to be digested down from proteins, the peptides, to amino acids, which are the smallest, and then they need to get through the gut. And when they get through the gut, your body uses them to rebuild tissue and things like that. But if bigger molecules like proteins and peptides get through, like gluten, which is considered an antigen, your immune system starts to attack that. And when it starts to attack that, eventually it starts to create what's called an autoimmune problem. Your fibromyalgia can be caused by an autoimmune disorder, an underlying autoimmune disorder. But Dr. Childs, I've already been tested. I don't have rheumatoid arthritis. I don't have lupus. I don't have anti-nuclear antibodies that are positive. I don't have rheumatoid factor. Those are tests that test tissue destruction after you've had autoimmune processes going on in your body for so long that, bang, you've got damage to tissue. See, patients with fibromyalgia, they feel bad because they have an underlying immune problem. Their immune system is actually attacking their self. Hashimoto's thyroiditis. Most patients with hypothyroid, and a lot of patients with fibromyalgia have hypothyroid. It's Hashimoto's hypothyroidism. It's because their immune system's attacking their thyroid. We need to do that. Now, the immune panels are very important. If you have problems with your immune panels and you have an autoimmune problem, it trumps everything. We have to fix that. The other important thing is anemia. Anemia and autoimmune, we've got to get that under control because anemia carries oxygen to your tissues, and if your body's attacking itself, you're never going to get better unless we reduce that. So the immune panels we run TMB lymphocytes, natural killer cell panel, we run the cytokines. Cytokines are interleukin 2, TNF-alpha, interleukin 4, and interleukin 10, and we also run natural killer cell activity. There's two parts of your immune system. There's the Th1 side, there's the Th2 side. Th1 are your T cells. They go out and do the attacking of any antigens, any viruses, any bacteria, and you need these things, but if they get too high, that's not good. So Th1 again is interleukin 2 and TNF-alpha. Tissue necrosis factor alpha, and then interleukin 2 is your B cells. Your B cells are your memory antibodies. They go around and tag things and say kill this, kill that, don't kill this. And if that gets haywire, then you have problems. That's interleukin 4 and interleukin 10. We can test for these cytokines. You have to run these tests if you have fibromyalgia. Again, we talked about T cells, we talked about B cells, and we need to find out if you have an active antigen. An active antigen means that you have something in your body that your body's trying to kill that it can't kill. And it causes your immune system to become balanced abnormally, meaning the Th1 goes too high or the Th2 goes too high. That's the definition of an underlying autoimmune problem that eventually becomes rheumatoid arthritis down the road. Okay? So active antigens are parasites, bacteria, viruses, molds, yeast, fungi, protozoans, foods, chemicals, foods which are the different things that we talked about in our sensitivity testing. We're talking about the gluten, the soy, the yeast. A lot of patients are very highly sensitive to this. Now, why is gluten such a bad thing? Well, because the wheat of today is genetically modified, which makes it very, very resilient. They do that so the crops don't die with the weather changes and the birds and the insects and things like that, but then it becomes a very indigestible protein, and it causes sensitivities and autoimmune problems. We need to run a CD4-CD8 ratio to see if you have an active antigen, or to see if you have an immune dysregulation. Immune dysregulation is from long-standing adrenals that are stressed, long-standing blood sugar problems, insulin resistance, hypoglycemia, things like that, anemias. We run a DNA stool ecology, which is going to let us know if you have any dysbiosis, which is too much bad bacteria. We find out if you have any parasites. We can also find out if you have too much yeast. These things cause leaky gut. We can do that. We have to run that test. We can test for H. pylori. H. pylori is another bacteria in the upper GI. We can test for inflammation. Patients with fibromyalgia have a lot of inflammation. They have high C-reactive protein, high homocysteine. That usually is due to an underlying autoimmune problem. It's not due to a lack of anti-inflammatories. We can test for neurotransmitters. We can test and see, do you need serotonin support? Do you need dopamine support? Do you need gabatone support? Do you need acetylcholine support? And we can run hormone panels, estrogen levels, progesterone, all those things. What we do is we take all these tests and then we develop a specific tailored nutritional approach, void of any of the sensitivities that you have. And we use specific types of nutraceuticals, non-drug nutraceuticals that have been studied to help patients with chronic pain and chronic conditions. So that's how we treat patients metabolically. Now the big question is, have you had all these tests performed by your other doctors? And the question is why not? Now the reason why not is most of these doctors are not even aware that these tests exist. Most of these doctors only do the very narrow standard of care. They run these tests. If you're not in the laboratory range, then you're fine. That's basically what they do. They don't run these autoimmune panels. They wait until you have a really bad autoimmune problem. They run things like ANA and rheumatoid arthritis panels. But they don't actually run these tests because these are integrated functional medicine tests that functional medicine doctors look at. So a lot of times it'll come up, Dr. Childs, can I just get these tests run by my medical doctor? Can he just run these tests for me? And the answer is no, because the big question is, if he's trying to help you, wouldn't he have already run these tests to begin with? How come he's holding back and not running these tests? Because he really doesn't know about these tests. These are specific tests. The other thing is insurance only pays for some of the tests. Some of the tests they don't pay for because it's out of that standard in-the-box care. You have to step out of the box if you want to get better with fibromyalgia. Remember the insanity thing? Doing the same thing over and over again is going to cause what? The same result. That's insanity. Okay? Let's talk about the next thing. We've got metabolic on one side, the other side, the right hand, is the neurological treatments. We do neurological treatments based on specific neurological tests. So we treat the brain and nervous system. As a chiropractic neurologist, we treat the brain. Let's talk a little bit about the brain. When you look at the brain, you have this part up and through here. This is called the cortex, and the cortex has different lobes. It's got the frontal lobe, it's got the parietal lobe, the temporal lobe, the occipital lobe. Underneath of the brain, you have the cerebellum, which controls balance and coordinated movements. That's why a lot of patients with fibromyalgia, they start to have bad balance or they feel dizzy. Then we have the brainstem. We have the lower brainstem and the upper brainstem. Patients with fibromyalgia have a high-firing upper brainstem. The upper brainstem is very important for a lot of functions in your body, but when it fires too high, it causes a real overzealous sympathetic or stress response in the body. The lower brainstem is the parasympathetic brainstem, and when it's running good, it sort of keeps the upper brainstem in check. When you have a high-firing upper brainstem, you can have all kinds of problems. But let's first talk about how the brain works. So the cerebellum fires to the brain, and then the brain fires down to the lower brainstem. And the lower brainstem then keeps the upper brainstem sort of calmed down or sort of regulated. The upper brainstem is like an unruly teenager. If it's let loose or allowed to just do it at once, it's going to get into all types of havoc and cause all types of problems in your body. What types of problems? Chronic pain and chronic fatigue. When the upper brainstem fires too much, fires down your spinal cord, and it causes C pain fibers to fire too much. This is why you've got this achy, feeling like you have the flu 24/7, because these C fibers are firing all through your body, but it's neurological. It doesn't really mean you have a problem with your arm or a problem with your knee or a problem with your back or a problem with the bottom of your feet. It's because these pain fibers are firing because of this upper brainstem. Migraine headaches and light sensitivity. When the upper brainstem fires too much, you're sensitive to light. Okay, you have migraine headaches because the nerve mesh gets irritated surrounding your blood vessels. We see a tremendous amount of migraine headaches. As a chiropractic neurologist, that's one thing that I see a ton of. Blurred vision, increased sweating, sympathetic nervous system. So a lot of patients have real clammy hands. They may have like sweaty palms, things like that. Difficulty falling asleep. Upper brainstem has got the mesencephalic reticular activating system. When that's firing too fast, you can't fall asleep, or you may fall asleep in the middle of the night and then you pop up in the middle of the night and you're up the rest of the night. Insomnia, we have to get you sleeping better if we're going to overcome your fibromyalgia. Patients with fibromyalgia do not sleep well, either due to a high-firing upper brainstem or due to adrenal issues. Remember we talked about that cortisol rhythm. Heart palpitation, increased heart rate. They kind of feel like this fluttering in their chest. Irritable bowel syndrome. If the lower brainstem is not firing good because the upper brain is not firing down to it, you start having irritable bowel problems because the lower brainstem controls most of your digestion. It controls the vagus nerve that goes down there. We have urinary tract infections. Patients with fibromyalgia tend to get more of those because their sympathetic nervous system is what will inhibit your ability to urinate, and so you actually create bacterial infections. High blood pressure, fibrofog. A lot of patients have a left brain that's not firing very good, and in the left side of the brain you have what's called Broca's speech area. And Broca's speech area is a part of your brain that actually allows you to speak, to be fluent. And so a lot of times patients will be kind of in a fog, they may be depressed, and they can't seem to say the things as quick as they like to. They lose them on the tip of their tongue, the words that they're trying to say. That's Broca's speech area. What causes all this? Physical, emotional, and metabolic stress. Metabolic stress, we talked about that. Autoimmune issues. There are antibodies that will attack your cerebellum. We can test for those. Patients that have emotional stress. Emotional stress causes your body to create too much cortisol. Cortisol from the adrenals is toxic to your brain. It shuts down the hippocampus and it shuts down other areas in your brain as well. Physical stress, disc problems, herniated discs, arthritic problems. That affects the way the cerebellum fires because your brain needs information. It needs what's called afferent stimulation coming up from the bones of the vertebral column. So physical stress, car accidents, things like that. Fibromyalgia does not get better by itself. This is a study. The longer you have fibromyalgia, the more and faster your brain dies. They've done studies on the brain, and the brains of fibromyalgia patients are actually smaller. They shrink faster. Very important to understand that. That's why we need to treat them neurologically. So what we do is we do a comprehensive neurological exam. We're going to look at your blood pressure. We're going to look at your tissue oxygen saturation. We're going to check your heart. We're going to check salivary pH, which lets us know how much oxygen you have and how much you need. We're going to test your reflexes. We do a complete eye exam, and we measure, not vision, but we measure your ocular motility. Patients with brains that aren't firing good, they've got really choppy eye movements, and we can really home in and find out which part of the brain needs to be affected based on these eye movements. If you have trouble looking to the right, it's left brain. Trouble looking to the left, not that you can't, but the eye movements are choppy or they're not accurate. We do cranial nerve tests. We're going to test your smell. We're going to test your pupil reactions. We're going to test all the nerves that come off of the brainstem, which are the cranial nerves. We're going to test the cerebellum. The cerebellum is, again, the back part of your brain. We're going to test your balance, your coordinated movement, mental function, cognitive function. Cerebellum is very important. Okay? So that's some of the tests that we do. In fact, with the eye exam, we actually put a pair of goggles on you. What these goggles do, they're called Realize. It measures eye movements infrared with an infrared camera. And what that basically will do is we can look at the eye movements, we videotape them, and we can pinpoint specific areas of your brain that are not firing the way they need to fire. I'm not talking about tumors or strokes. They're hard lesions. I'm talking about soft lesions, parts of your brain that aren't firing good because of the fact that there's physical and mental and chemical stress that's been affecting them, and now it's kind of like a weak muscle in your brain. Okay, so it's not a diseased muscle. This is why when you go get brain MRIs, everything is negative because you don't have a tumor, you don't have stroke, you don't have those types of brain injury. Okay, these are soft lesions we're looking for. A couple therapies that we use oxygen therapy. Oxygen is fuel for the brain and nervous system. Our goal is to get your brain and nervous system functioning better. So we put patients on oxygen therapy with exercise. If they're going to do an eye exercise to affect their cerebellum, they're going to do that on oxygen. Oxygen is critical. Oxygen is huge for getting you to sleep because oxygen kind of slows down the upper brainstem. When the upper brainstem is going too fast, you're not sleeping. So oxygen will do that. So oxygen therapy is one of the big things. It's one of the missing things in treating patients with fibromyalgia. We use it in our office. We use brain-based therapies. We use the interactive metronome, which is a computer-based program. This girl right here is doing that. Basically, the interactive metronome trains the frontal lobes because what it does is it develops rhythm and timing, and you have to focus, and it's going to develop better function in the frontal lobes. We can use eye lights, or specific types of lights, to work on specific parts of the brain. We can use something called OPK tape, which basically will exercise a certain hemisphere of the brain. The HemiStim programs, the Rebuilder, the Health Light Booties. The list goes on in how we help patients with fibromyalgia. We have to address them neurologically. We use something called the ATM2, which is a machine for patients with fibromyalgia that if they bend to the right or bend to the left or bend down, they've got chronic pain. Or they bend this way and they're like, ah, that hurts. What we can do is we put them in that machine and we strap them in, and when they bend to the right, they'll be pain-free, and we exercise them in that position. When we exercise them in that position, what it does is it sort of resets the brain and tells the brain, hey, listen, we don't need to have pain in this range of motion. So when a patient gets off, let's say they have pain bending to the right, they get off the ATM, they'll be able to bend pain-free. It's an incredible machine. We use that with a lot of our chronic pain patients, our disc patients. We use non-surgical spinal decompression. A lot of patients with fibromyalgia have disc problems. They have herniated discs in their neck, or they have herniated or bulging or degenerative discs in their lower back. So we'll do spinal decompression therapy as well, but when we do spinal decompression therapy, we put them on oxygen, because when we put them on oxygen and we stretch them, that creates fuel, which is the oxygen, and activation. And the activation then fires input up to the cerebellum, and it makes the cerebellum function better. So it's not just a structural problem, it's a neurological problem that the decompression works on. We also do biomechanical spinal correction. So we look at patient's spine. Almost always patients with fibromyalgia have like a forward head posture, or they may have a low shoulder, or they're kind of hunched in like this because their brain is not firing good. A good brain is going to cause them to stand nice and straight. What happens is they get kind of slouchy. And so we can do very gentle chiropractic care. We don't even need to use manipulation. We can use really light instrument forces. We will use manipulation in patients that can tolerate it. We'll determine that in our exam. The exam lets us know what a fibromyalgia patient can take. So again, we do correction. This is the curve that the patient needs to have. This is where the person was. And after post-care, we restore that arc back in the neck. We want to do that with our fibromyalgia patients. We want to get their posture better. We do laser therapy. Laser therapy is great for the trigger points of fibromyalgia. It reduces and eliminates acute and chronic pain. It reduces inflammation and swelling. It stimulates and improves nerve function. It strengthens and repairs bone and soft tissue, and increases mobility and muscle function. Laser therapy, it's like a pad. It's an infrared pad that you lay on. Here's the deal. All of your chronic conditions, your fibromyalgia, your vertigo, your sciatica, your ADD, your ADHD, your brain injuries, your MS, all these things have a couple common threads. Oxygen deficit, neurological misfiring, blood sugar, cortisol hormones, and anemia. We have to test these. We have to check you metabolically and neurologically if we're going to get you well, no matter what condition you have, but particularly for fibromyalgia. So what we have to do is we have to put all these pieces together. We got to look at cortisol, blood sugar, hormones, cerebellum, cortex, look at your brain, okay? And we got to get the whole picture together. We have to treat the individual as a whole, and that's what's going to make the change. So if you have fibromyalgia, I want to ask you a couple questions. This is the question I want to ask you. How has your fibromyalgia affected your relationships with your family members, your family, your finances, or other activities? Are you enjoying yourself? Are you enjoying life to the fullest? Patients with fibromyalgia, they slowly stop enjoying life. And if that's you, you have to think, are you doing the right things? Are you doing the same things over and over again and expecting a different result? Like Einstein said, that's sort of insane. You need to find the true cause of the problem. Question number 2, what does this fibromyalgia cost you in money, time, and happiness? Are you unable to do the things you want to do? Are you unable to go shopping? Are you unable to go and enjoy time with the grandkids? Are you unable to spend time with your family? Are you exhausted all day long? Okay. Number 3, where do you picture yourself in the next 3 to 5 years? I can already tell you, patients with fibromyalgia, they usually don't get better with the medications. In fact, they usually need more and more and more and more medication. And so think about it. Where do you think you're going to be in 3 to 5 years if you don't take care of this problem, if you don't take care of the true cause of the problem? Okay. So the other thing to think about is, how do you want to address this problem? I basically want to let you know that I do not accept every patient that comes into my office. And it can be really heartbreaking at times because you know the patient can get well. But some patients are just not ready to get well, meaning they're not ready to make the changes. They're not ready to remove gluten from their diet if that's a problem. They're not ready to do all the things that are necessary in the office. They're not ready to come to the office and improve their health. So the question is, do you want to improve your fibromyalgia? Are you looking for the true cause of the problem? Or you want to go on and just take medications and keep masking the problem? It's up to you. But if you're coming to my office, understand that it's going to take some work. It's going to take some time to get you better. So that's my presentation. If you come into the office for a consult, we will check you over. We'll look at you neurologically and metabolically. If you're on my website and you want to have more information, you can just go down a little bit lower here. You can put your name and email in. We'll send you out a full report. And I also have another video where I go over the neurological causes of fibromyalgia in more detail. So if you want that information, put your name in or give our office a call, and we can talk about getting you back on the road to health. Thanks a lot. Take care.